Dr. Kristie Ebi is a professor in the Center for Health and the Global Environment at the University of Washington. She has been conducting research and practice on the health risks of climate variability and change for 25 years, focusing on understanding sources of vulnerability, estimating current and future health risks of climate change, designing adaptation policies and measures to reduce risks in multi-stressor environments, and estimating the health co-benefits of mitigation policies. She has supported multiple countries in Central America, Europe, Africa, Asia, and the Pacific in assessing their vulnerabilities and implementing adaptation policies and programs. She has edited 4 books on aspects of climate change, has more than 200 publications, and has been an author on multiple national and international climate change assessments. Please welcome Dr. Kristie Ebi.
Well, thank you very much for the kind invitation. Climate change obviously is a critically important topic this week as the Conference of the Parties is going on in Glasgow. I'll talk a little bit about climate change and health and hopefully leave plenty of time for questions. I wanted to start with one of the conclusions I hope you'll walk away with, is that when we think about climate change and health, we should be thinking about children. In the United States, when you say climate change, people often think about polar bears. But when you look at the health risks of a changing climate, about 85% of those risks are in children. And so we should be thinking about children today and into the future. Climate change is a complex set of alterations to our physical environment. It's caused by emitting greenhouse gas emissions. The major one is carbon dioxide. And there are pathways by which carbon dioxide itself affects our health, separate from its impact on rising temperatures, sea levels, extreme weather and climate events. And those changes to our atmosphere, to our oceans, to the cryosphere, act on our health through a variety of intermediary pathways. And I've listed a few of those there. There's a wide range of demographic, socioeconomic, environmental, and other factors that influence the magnitude and pattern of health risks. And so when we think about what the consequences for our health with our climate change, we need to look at it in the context of a wide range of other changes. And this is where this clearly fits into the One Health paradigm. When you think about those interactions between climate change, all these other factors, they then affect the exposure pathways that those of us who work in health are quite familiar with, extreme weather events and on across. Underneath, you can see a short list of the climate sensitive health outcomes that have been the focus of research. These are not all of the health outcomes of concern. A major challenge in our field is that there has really been no funding. And as we have more understanding of how weather and climate affect our health, the list of examples will only grow. All of the health risks of a changing climate are current problems. This means there's deep understanding of which individuals, which communities are at much higher risk. We understand the exposure and the vulnerability for particular groups. This slide is from the 4th U.S. National Climate Assessment and gives you some examples of some of the groups at higher risk and explains what can be done to help reduce their vulnerabilities. And I'll talk more about several of these as I go through my slides. I'm talking primarily about health, but need to remind everybody it's not just our health, it's our health systems. This figure, also from the 4th National Climate Assessment, shows Charleston County and Miami-Dade County and shows the hospitals that are at risk from different categories of flooding from hurricanes. It's not just these 2 places. Around the world, there are so many healthcare facilities in harm's way. It costs quite a bit to build healthcare facilities. It's a area where there is not a lot of profit margin for the people who build these. And so you often see the facilities built in places that are at greater risk, for example, of flooding, because the land is cheaper. And that is going to have consequences as we go forward and more healthcare facilities are affected. As I go through my talk, I'm also going to include some slides from the 2021 Lancet Countdown report. It was published last week. And I hope you've taken a look at that. You can see that the overall message was code red for a healthy future. That message is being strongly taken to the Conference of the Parties that's going on right now. And you can see some of the conclusions on the right, that it's important as the world begins to recover from COVID, that the equitable response is applied as well to climate change. There are deep inequities when we think about climate change. The countries that are causing most of the consequences of climate change, most of the greenhouse gas emissions, are of course the high income countries that are often better placed to be able to manage the changing risks. Those who are most affected typically are those who release the least greenhouse gas emissions. When you look within countries, it's the same pattern, that those who are poor and marginalized are at greater risk in general for climate change and are doing the least to cause the problem. I want to talk just about some of the issues. One of them is extreme weather and climate events. These are just the billion-dollar disasters through July of 2021. You can see there, I apologize, it's through September. So far, there's been 18 separate billion-dollar weather and climate disasters in the US. These are just billion-dollar climate disasters. They're not the $100 million climate disasters, the $1 million climate disasters. So these are just the worst of the worst. And these are costing the US hundreds of billions of dollars. When you hear that it's too expensive to address a changing climate, frankly, it's too expensive not to. That the US and other countries can't continue to pay for the extreme impacts from these weather and climate events, which of course are increasing in a changing climate. When the Lancet Countdown looked at some of these data, the data are categorized by the Human Development Index, the HDI, and it categorizes countries not just on GDP, but other measures of capacity. And you can see in the figure for the low Human Development Index countries, the low HDI, there's been an increase in the number of people affected, number of people who've died in extreme weather and climate events. For middle and high HDI countries, there's been a significant increase in the number of extreme weather and climate events, but there's not been an increase in the number of people affected. That our early warning systems, our infrastructure have been modified in ways that that vulnerability has not increased. When we think about extreme weather and climate events, I also wanted to point out the significant impact these events have on mental health. There are very good data from Public Health England. It's now the Health Security Agency in England. There's been several large flooding events. This one was several years ago. And usefully, the analysis was by houses, residences that were flooded, those where the residence was disrupted, and where there was no flooding. And you can see that the people who lived in these locations, lived in these particular residences, had very significant different experiences with mental health. And this is not long after the flooding event. You can see the large difference between the groups. There's been follow-up now for, I think, almost 4 years. And the numbers are reduced as one goes forward into time for probable depression, anxiety, and PTSD, but still elevated for people who lived in residences that were flooded over people whose lives were disrupted and those who were not flooded at all. If you did not hear, July was the hottest month ever recorded on Earth. That there's been temperature measurements, there's been rain gauges set out for almost 150 years. And this was the hottest month ever recorded. The land surface temperature in the Northern Hemisphere was 2.8 degrees Fahrenheit above average. And you can see around the world the number of warm records that were set. I live in the Pacific Northwest, and we had the heat dome at the end of June. So it's technically not in July, it was at the end of June, where temperatures were 5 degrees Celsius above normal in many places. There were about 1,000 excess deaths associated with that heat wave. So people continue to suffer and die in heat waves, and there is a lot that can be done about that. There's a lot that's known about the human body and how it responds to increasing heat. Our body has several mechanisms by which we can reduce that excess heat in our core body temperature. And when those fail, our core body temperature starts to rise. Our cells, our organs operate most effectively within a pretty narrow temperature range. And as the temperature goes above that range, you start seeing impacts on many of our organ systems. You see examples here, particularly for the heart. When analyses are conducted after a heat wave to look at the number of excess deaths, how many deaths occurred over and above what you would have expected during that time of year, you typically see that about half of the deaths are due to heart disease or some variation of heart disease. So we understand what heat does to our body, which means there's deep understanding of what we need to do to help prevent people from suffering and dying in heat waves. Overall, almost all heat-related deaths are preventable. And there's lots we can do to start taking actions to reduce that vulnerability as temperatures continue to rise. Overall, you can see since 1980, the exposure of vulnerable populations to heat waves has increased, looking particularly at adults over the age of 65 and babies. And you can see the numbers. These are from the Lancet countdown. Children younger than 1 year were affected by 626 million more person days of heat wave exposure. Adults over the age of 65 by 3.1 billion more personal days of heat wave exposure than the average over 1986 to 2005. Real significant increase in all countries. There's been occasional declines, but not in the last 10 years. And this translates, as I implied before, into heat-related mortality. There's lots of different ways to count how many people died in heat waves. The best estimates come from doing the analyses I mentioned before of looking at excess deaths. The estimates for the US of the number of excess deaths per year from heat is about 12,000. So lots of lives that can be saved by taking effective action. Hundreds of cities around the world have heat action plans. These are plans that include both developing heat wave early warning and response systems and long-term planning for how to modify our cities as our temperatures continue to rise. You can see an information poster from Quebec on the left. You can see some information on the right for some other places in Canada that are taking action. And I did want to highlight again that the inequities here are very large. Particularly in the US, many of our red line districts have fewer trees and then tend to be much hotter than the surrounding areas. And so as there's work being done to help modify our cities for a warmer future, we need to think about how to do that in the context of reducing the inequities that are causing unequal impacts today. Many cities, as I said, have heat action plans. This is one from an area of India that's particularly hot and dry. It's not very far from Pakistan. And I wanted to mention this one because I just happened to be at one of the first meetings of developing this heat action plan. And we had a meeting with one of the local hospitals. They have air conditioning, but really not very much air conditioning. And we'll just say that there was issues in a recent heat wave with the neonatal ward. And that neonatal ward was on the top floor of the hospital underneath a metal roof. So one of the actions that was taken to help reduce the risks to babies during heat waves was to reorganize the hospital and move that neonatal ward to a place that was cooler within the hospital. It's just an illustration of how when we think about these health risks, they're all of society risks. And we need to think about how we can interact with other sectors to make sure that we do protect and promote human health, even as our temperatures continue to rise. Wildfires, particular issue here in the Pacific Northwest. You can see from the Lancet countdown that there was an increase in the number of days people were exposed to very high or extremely high fire danger. And that's going to continue to increase because of climate change, stressing our forests, because of forest management, because of changes in precipitation patterns. We know that wildfire smoke increases risk for diabetes, lung disease, and heart disease. I put this particular figure in. You see the air quality index across the bottom. That is for PM 2.5. And you can see it goes up to 120. 2 summers ago, when we had particularly bad smoke blowing into Seattle, the air quality index in my neighborhood was 250. In Los Angeles this summer, one of the neighborhoods that was receiving extensive wildfire smoke had an air quality index of, I think, 745. So the exposure levels are really high, putting, again, vulnerable people at very high risk. If we were in person, I would ask how many of you have allergies or asthma. It's usually about 1/3 of the population. With climate change, our summers are getting longer. Spring starts sooner, fall starts later. You can see on the left, this has resulted in a change in the ragweed season. And you can see that in parts of Saskatchewan, we're looking at almost a month longer in terms of how long the pollen season is. Even in your region, you can see several week longer pollen season. Carbon dioxide itself affects pollen production, and at higher concentrations of carbon dioxide, there's going to be a lot more pollen. So a world with more pollen, more allergies, and probably more asthma. On the bottom, I don't know if you've got poison ivy. We don't have it here in the Pacific Northwest. I know it's throughout much of the Midwest, but you can see that with more carbon dioxide, there's more of the toxic oils in poison ivy. One of the biggest, probably the biggest challenge we're going to face in terms of the risk for health is in food security. Right now, there's 600 to 700 million people in the world who are food insecure. The reason it's such a concern is shown on this slide. This is for wheat. It's true for other cereal crops as well. Not all the crops are affected as strongly as wheat, but between wheat and rice, they constitute about 85% of the calories around the world. You can see in temperate regions on the left, as local mean temperature increases, depending on assumptions about adaptation in the blue and in the red, you can see that there's very little change actually in wheat yields. The problem is the tropics. You can see that with any increase in local mean temperature, a decline in crop yields. And that has impacts on the people who are already food insecure. The figure on the left shows how under different emissions, low and high emissions, in 2030 and 2080, different climate models, what the projected change are in crop yields. Right now, we're still, unfortunately, under high emissions, and you can start seeing a pretty significant decline in crop yields, depending on the model that's looked at. On the right, this shows you this decline in crop yields translates directly to stunting of children, with large increases in severe stunting. And you can see that towards the middle of the century, we're talking about very large increases in the numbers of children who are at risk. As I mentioned a moment ago, it's not just warming temperatures, it's also higher concentrations of carbon dioxide in the atmosphere. You may have read that CO2 is a plant food, and that's true. 85% of our plants have a particular mechanism whereby they pull in carbon dioxide from the atmosphere, break it apart into the carbon molecule through the photosynthetic pathway, and use the carbon to grow. So yes, CO2 causes most plants to grow, but it also changes the internal dynamics of the plant, and you end up with more carbohydrates and about 10% less protein, about 5% less micronutrients, and on average, about a 30% reduction in the B vitamins. The micronutrients are particularly important because there's about 2 billion people around the world who have micronutrient deficiencies, and of course, many more who are susceptible to that. There's something like 1 to 1.5 billion women and girls worldwide, including in the United States, who have iron deficiency anemia. So the reduction in the concentration of the protein and the essential micronutrients is projected to affect hundreds of millions of people around the world as CO2 concentrations continue to increase in the atmosphere. This study tried to pull together the positive influences and the negative influences of climate change, technology change, this penalty on nutrient content, to look at the global availability of dietary protein, iron, and zinc. And you can see, even taking into account the positive influences, that by mid-century, it's projected there'll be decreased growth in the global availability of protein, iron, and zinc by 15 to 20%. So again, hundreds of millions of people are likely to be affected unless there's a lot of action taken today to understand how we can really get around the carbon penalty on nutrients. Moving on to everybody's favorite topic, vector-borne diseases. I put this cartoon in because, of course, the mosquito has to be Betty, because it's only female mosquitoes that need the blood meal to lay their eggs. I'm not going to go through this slide, but I wanted to just highlight that there is quite a lot known about how temperature and precipitation affect the development, survival, and reproduction of mosquitoes in this case. And in turn, temperature affects the replication and the transmission of the viruses that mosquitoes can carry. There's a slightly different cycle for ticks, but again, for ticks, there's very strong influence of temperature on the survival of the tick and the transmission of diseases such as Lyme disease. The mosquito we're particularly concerned about with climate change is Aedes aegypti. It can carry dengue fever, can also carry Zika virus, chikungunya, and yellow fever. And this is some pretty interesting modeling work. On the left, it shows suitability for Aedes aegypti. And the beige areas are places where the climate is currently suitable for Aedes aegypti. By and large, vector surveillance in the United States is not where it needs to be. So these are based on models, they're not based on actual vector surveillance programs, although they've been verified where it's possible. And under high greenhouse gas emissions in the red area, you could see where the climate would be suitable for Aedes aegypti, including around Seattle. But it's not just having suitable climate, you have to have a summer that's long enough and hot enough so that you can have dengue fever, for example, introduced, Somebody comes in with dengue fever, is bit by a mosquito, the virus replicates in the mosquito, and then is then transmitted to another human being. And you can see a very significantly reduced increase in the range for suitable transmission for Aedes aegypti, which is great. It's a very positive, not great for the Midwest, but it's very positive for much of the country that we wouldn't see such a huge expansion of Aedes aegypti. However, breeding colonies of this mosquito in 2017 were found in Toronto, Toledo, and Detroit. This is a mosquito that is very difficult to control. It'll fly a mile to bite a human. It replicates in the water in the bottom of a flower pot. It lives around our houses and very, very difficult to eradicate. Also, Aedes aegypti has figured out that sewer systems are a great thing, and it can overwinter in sewer systems. I haven't done so, but entomologist colleagues have gone into sewer systems and said there's millions of mosquitoes down there. And usefully, we've got ways for them to come and go from the sewer systems. And so we're seeing these mosquitoes overwinter in places where you think it would be too cold. The bottom left shows just for San Francisco, a large increase in the number of mosquito days just from the 1980s. And that will, of course, continue. And just like with heat, there's lots of opportunities for developing early warning and response systems. The top figure shows the difference between having no surveillance for some kind of disease versus passive surveillance when there's an outbreak. And that's a real traditional curve, outbreak curve, and showing that even with passive surveillance, that you can start detecting the first case early, you can start responding early, and that means you can really reduce the number of people affected. The second figure shows even greater opportunity with developing early warning systems using environmental information. For example, Singapore has one of the best control programs for Aedes aegypti in the world, and they're developing an early warning system. We're using information primarily about temperature, but using other environmental information, they can forecast up to 4 months in advance when the conditions would be appropriate for an outbreak of dengue. And that's 4 months to warn pregnant women, to clean up breeding sites, to have educational programs. And in that case, you can really make a significant impact. So as we go forward, we're going to see much more effort on developing these early warning systems to take advantage of the data that have already been collected.
Sorry to interrupt. I think your slides were frozen, but it looks like we're back on track now.
Okay, they've obviously been working on my side, but if you'd let me know. Okay. I want to move on to something that's been used for quite a few years, since 2001, in the Intergovernmental Panel on Climate Change. And it's a way to synthesize a lot of information into a visual image that's been very useful for decision makers. Because of the color scheme, we call these the burning embers. And these are the burning embers that were published in the IPCC Special Report on Warming of 1.5 degrees. And I'll speak from one more to coral so you can understand how to look at all of these. The zero line are pre-industrial temperatures. As you go up the y-axis, it's increases in global mean surface temperature above pre-industrial. The gray bar was the global mean surface temperature at the time we were working on the report, or just before we were working on the report. You can see 2006 to 2015. The Earth has now warmed about 1.2 degrees Celsius above pre-industrial. When you look at each of the embers, the white area indicates that we haven't been able to detect whether there's been any change in the system in warm water corals. And so we don't know if climate change has made a difference or not. It may not have made a difference. It may have made a difference, but we can't detect it. We don't have surveillance systems. The system's complicated. There's a bunch of reasons why it'd be difficult to detect. When the color turns to yellow, it means that there are impacts attributable to climate change. that there has been a formal process of doing detection and attribution, and we know that climate change is affecting the system. Red indicates the risks are severe and widespread, and purple is very high risk, with the presence of possibilities of irreversibility. The report concluded for warm water corals at 1.5 degrees of warming, about 75 to 90% of warm water corals would be gone. At 2 degrees, they could all be gone. And this just speaks about the warm water corals. It doesn't talk about the hundreds of millions of people who get most of their protein from the sea. And what's going to happen, particularly in small island countries in the Pacific and in the Caribbean, when they lose those corals, lose the reef fish, and then what's going to happen in terms of their food security. On the far right, you can see heat-related morbidity and mortality. I'll talk about that more in a second. We just published Burning Embers for Health. So these follow the same color scheme, follow the same baseline is pre-industrial temperatures. We did the embers for heat-related morbidity and mortality, for ozone, for West Nile, Lyme disease, dengue. Sorry about that. Let's try to close the bar at the top. I'm not succeeding in doing that very well. We also took a look at how development matters. The SSPs are shared socioeconomic pathways. They're visions of how development could evolve into the future. The ember on the right for each of the set is a world with very high challenges to adaptation and to mitigation. And the ember on the right is a world aiming towards sustainable development. And so you can see when you look at these, a couple of things. One, how the health risks are projected to increase with each unit of warming. And you can also see how much our development choices matter. How we urbanize, what we're going to do about wash. All kinds of factors will affect how vulnerable future populations will be to climate change. When we think about what needs to be done, countries are developing national adaptation plans. This is also from the Lancet Countdown. And you can see that a survey was conducted by the World Health Organization of the 196 countries in the world. About 91 reported. Of those, half basically have national health and climate change strategies or plans in place. But most of them said that they had insufficient funding to be able to attack the various challenges with new interventions, with new programs, in some places with new infrastructure. When you look at the amount of funding that is going out for adaptation across the world, only about 0.5% of all of that funding has gone to health. So countries are starting to do more to identify what it is they need to do to have climate resilient health systems, and they need the resources to be able to do so. And I wanted to end with a couple of comments about our carbon budget, particularly in the context of what's going on this week and next week at the COP, and talk a little bit about health co-benefits. There's been decades and decades of research about our carbon cycle, of what happens when carbon is released into the atmosphere. Most of it goes eventually into the oceans, into the soil, into rocks. It takes over 100 years for the carbon dioxide in the atmosphere to come to equilibrium. And from this deep understanding, it's possible to estimate the carbon quota, in this case for a 66% chance of keeping warming to below 2 degrees C above pre-industrial. When you look at the figure, you can see in black the total quota. In dark green, you can see the non-CO2 emissions that have already occurred, methane, for example. In the medium green, you can see past fossil fuel emissions. So these are our carbon dioxide emissions. In the lighter blue, green color, you can see past land use change. And in the blue, you can see the total remaining carbon budget. That's it. And this is why the negotiations are so intense. That if the US and China don't rapidly reduce their emissions, they will use up that carbon budget in a couple of decades. And that's why you'll see so much discussion coming out of Glasgow about what countries are going to do to reduce their carbon budget so that there is carbon dioxide essentially available for the low and middle income countries. All countries have developed in the past by burning fossil fuels. The low and middle income countries have every right to develop. And so there needs to be, for them, access to new technologies so they don't have to burn fossil fuels, but there also needs to be a buffer in case in the short term they need to. If you're not aware, when we look in the United States, our #1 source of greenhouse gas emissions is transportation. So finding ways to reduce emissions from transportation is as important, if not more important, than reducing emissions related to generating electricity. An important message that we've been trying hard to get out to policymakers is when you look at all the opportunities we have for reducing greenhouse gas emissions, almost all of those have health benefits. And when you start counting up the number of avoided premature hospitalizations, the number of avoided premature deaths, and you value those, economists like to value the cost of hospitalization, the cost of a premature death. The value of those health benefits are larger than the cost of mitigation. We should be mitigating for our health. And we really hope that this message comes through much more strongly in Glasgow, so countries understand that yes, there's a cost to mitigate, but the benefits for their population are going to be larger than those costs. Just one example, again, from the Lancet countdown of thinking about changing dietary patterns in the US so that people don't eat more red meat than their doctors recommend, because that excess consumption of red meat means increased mortality, increased morbidity, increased cost to our healthcare system. And with that, I really appreciate you listening and look forward to some questions.
So do we have, if you guys could either type in your questions into the chat, that might be useful, or you can unmute yourself and ask your question. And I can actually start if we don't have a question to start with, because I actually have several, but I will limit it slightly because Alyssa will tell me how much time we have. Yes, that 2 degrees difference is so amazing. And I always try to stress that to students. How do we get across to people that it's 2 degrees, doesn't sound like much, but it's huge?
There are so many good metaphors that you can use around that. One that we've been using for a while is when you think about people using performance-enhancing drugs. And you can use examples of any number of athletes who were accused of using performance-enhancing drugs. I will not opine on whether they did or not. But when you look at how little they take, and what a difference it can make in their performance. So we have lots of examples where just a small change in an input can have a huge impact on the output. And we can start thinking of other examples to use, but those kinds of examples in terms of the drugs, the performance-enhancing drugs, anybody who's got any kind of disease process where they need to take a drug, you're really putting a small amount into your body and can have a benefit or can have a pretty significant impact.
Well, I will say that in our laboratory, we have shown that just 2 degrees difference can mean a host will live and not be affected by a virus versus dying from it. So it's pretty huge. And I think we have some questions in the chat.
Yeah. In the chat we have, Dr. Pfefferman said she would love to hear your thoughts on best practices for communication, advocating, adopting mitigation strategies.
That's a great question. One of the issues I didn't cover is I hope you've looked at the 6 Americas. The 6 Americas is a program that's run out of Yale. And if you just put in Yale 6 Americas, it comes up right away. And they have been surveying the US population for quite a few years about their opinions around climate change. And it's been fascinating to watch those opinions and how they've shifted over time. I think it's 2/3 or almost 3/4 of Americans are concerned about climate change. More than 50% thinks that the US should be doing something about climate change. This is much different than what you see in the media, but this is an actual survey of people. And one of the last surveys came through and very positive results on the number of people who understand climate change, understand it's a risk, number who think it's a risk for their own health. But one of the really interesting results was they asked people if they talked to other people about climate change. So you're talking about 2/3 or 3/4 of Americans concerned about climate change. And only 1/3 ever talked to anybody about it. It's different on a college campus. Students do talk to each other. We do talk about it in classrooms. But people don't go out and talk with their friends, their families, their colleagues. And we need to have that happen to build the political will to make a difference. I think people would be surprised. There certainly are people who are still skeptical about climate change. It's okay to be skeptical, but you want them to have the best information that you can provide them. And there's lots of resources you can direct people to where they can get good information. But just starting those conversations can start making a difference. And then specifically about the mitigation, that message about the health co-benefits is really important. The more that people understand that reducing emissions from our tailpipes, reducing emissions from point sources, making our buildings more energy efficient will save us money, will improve our health, will be a message that's really important because we will see benefits in the short term that will be so beneficial to so many of us that we should, as I said, really start mitigating for our health and focus on those health benefits.
Thank
So
you.
what do you do on an individual level? So the one thing I always recommend, and I don't know your communities, but look around and see where you can volunteer your time on something of importance to you. In Seattle, we live in King County, and King County every other year has the Green Globe Awards. And they are so inspiring. They give out about a dozen awards every other year to individuals, communities. The last time, one of the tribes won for all the work they've been doing on cleaning up one of the rivers. You've got people who are advocating on climate change, people who are working on energy efficiency. And there's all of these opportunities to get out and work with people who've got similar concerns and really work on something you've got passion for. And that can make a real difference locally, and eventually, of course, it'll make a real difference globally, because every action we take matters. Every action to reduce our greenhouse gas emissions is going to be beneficial. So I encourage people to go out and find places where you can engage, and then think also about how you can set an example of biking when you can. You don't have to take a car. If you can bike, if you can walk, you can take the bus. Finding ways to show that there's lots of very positive changes we can make in our lives that reduce our emissions and are good for all. And I should say that there's lots of NGOs that will give you long lists of things that you can do. When Steve Chu was head of the Department of Energy, he liked to go around to college campuses. And one message he always had was, put your computer to sleep if you're not using it. That our appliances use 20% of all the electricity they'll ever use when they're in standby mode. Just put your computer to sleep. You don't have to shut it off, put it to sleep. We all know about the chargers for our cell phones are called vampires because they keep drawing energy even after your phone is charged. You can pay attention to those little things and it'll make a difference to how much electricity you use, and then of course how much greenhouse gases are emitted. We've got a question from Lewis about the poison ivy. It's a good question. There is a little bit of work in this area. There's essentially no funding. So there was a little bit of work on one of the major drugs that's used for malaria, comes from the plant wormwood. And actually that's increasing with climate change. That I mentioned, there's this particular mechanism for plants through photosynthesis to bring carbon in. And what happens is you're seeing an increase in the carbon in the plants and a decrease in nitrogen. So overall, you see an increase in the carbon-based molecules and a decrease in the nitrogen-based molecules. And so thinking about what's in the plant, then you can start looking at the shifts. This is often, I don't know, people often like hearing about this on college campuses for some reason. But one of the carbon-based molecules in plants is the active ingredient in marijuana. And the carbon growers understand that carbon dioxide increases the concentration of this compound. So my understanding is the marijuana growers have been growing marijuana under higher CO2 conditions for quite some time. And someone told me that one of the consequences is that the marijuana sold today has about 10 times as much active ingredient in it as a concentration of marijuana sold, I don't know, in the 60s and 70s. So there's been a real increase in that concentration, which is something that people should probably pay attention to if they decide they're going to be smoking marijuana, because it's a lot more potent. It's a direct consequence of CO2. Lewis, did that answer the question? I see that you, okay. I don't see any, oh, one new question came in. So the question is, how to convince people to timely issue? Unfortunately, the weather is convincing everybody it's a timely issue. If you start talking with people about how the weather has changed, for us in the Pacific Northwest, that heat dome was really massive. It's a very progressive area. We've been working on climate change a long time. Really concerned a lot of people. The flooding that's happened this year and last year, just all of the changes that are going on have been visible to all. And starting from what people are seeing literally in their own backyard is a great place to start, because people will tell you that things are different. If people watch birds, they can talk about changes in bird migration patterns. If you like the butterflies, there's been issues with the monarch butterflies. There's so many changes going on in our natural systems. And starting from that perspective gives you a solid basis for a discussion.
So you had, oh, I'm going to ask another question. So you had, you showed a chart where you had talked about stunting in children increasing and it being directly related with wheat production, I think it was. Is that, is that a prediction based on wheat production, or is it based on something else?
I'm not sure I understand the question. So that was for wheat.
Okay, so the stunting is based on food insecurity.
Oh, sorry. So the stunting in particular was based on overall reduction in calories. But as I said before, 85% of calories around the world come from wheat and rice. So it's based on overall reduction in cereal crop calories.
And then I have one other question, if I can ask it. Okay, so we know, so there's been a lot of work looking at the cost of the extreme conditions and what happens in them. I haven't really seen a lot on the cost of, and you did show a little bit of it, but okay, so maybe there are so many other changes taking place due to climate change. They might not be these extreme ones, but they're costly too, especially when you add it up over time. Has there been a lot done on that?
There's been a little bit done on that. And it's been done from the perspective for the negotiations of estimating the costs of adaptation. And when looking at the costs of adaptation for health, most of them focus 2030, 2050, and are really incredibly simplistic. Basically assuming the world doesn't change, it just gets warmer. So in 2050, we're all the same age, you're all in the same classroom. We haven't done anything different to the world, it's just gotten hotter. And the estimates overall are tens of billions of dollars a year to manage the additional cases of malaria, diarrheal disease, food insecurity. And we know if you start changing the world, you start adding more people to it, you start thinking about the other interactions you mentioned earlier with our ecosystems, that's a significant underestimate of how much the costs could be. You can look at what the world's paying right now for COVID. And so we know that we really are underestimating those costs, and they're still in the tens of billions of dollars a year.
And one more, sorry.
Sure.
So this is based on just because of, I know my own frustration and what's the right thing to do. And I know we have to do a little bit of everything that we can. But when we're looking at the big picture of fossil fuels versus electricity versus, you know, everything else, I struggle a little bit, like, because I think that there's this concept that once we switch from fossil fuels to electricity, we're not consuming any, you know, we're not producing any more CO2 and it's all good. But, you know, not only are we still producing CO2, but then we have all those, the batteries and everything like that. So what do you tell somebody who is struggling with that? And why can't we have, like, I know we still have to have batteries, but why can't we just switch to solar powered vehicles?
It's a great question, and we definitely need technology development. And there's been a lot of investments in technology development. Boy, if we could get really great battery storage, it would be amazing. It's something that there's been a lot of emphasis on the last couple of years. I keep reading about all these possible improvements in batteries. So that would be just a terrific thing. From the biggest perspective, I think one of the most important changes that could be made worldwide is every year there's something like $3 trillion spent in subsidies for oil and gas and coal. It's just an astonishing number. That when you think about the major oil and gas companies around the world, they're some of the largest companies in the world. They used to be the largest companies before technology took over, and yet they receive immense subsidies. And if those subsidies were taken away, we would be in a different situation, because the costs of our renewable energy sources have come down significantly, and it's not a level playing field. So if we can have some technology improvements, if we can reduce those subsidies, then you'll see that we'll have a real shift to renewables. In the US, you can see we've had a real shift away from coal in the last couple of years because it's no longer economically viable, that there's been a switch to natural gas. So fix some of the problems we have with how our taxpayer dollar is spent in subsidizing oil, gas, and coal, and we would see a much more rapid shift. And of course, we need to do it in a way that we can make it more equitable. I can afford to have an electric vehicle, and I do. That's not an option for many people. We need to find ways to ensure that everybody can afford to switch to our green economy.
Thank you. Do we have any more?
Yeah.
But one more question.
Okay, there's one more question in the chat. Given the wide cultural differences across the globe, do you have any suggestions on how to communicate climate change related topics in a way that it is applicable across cultures?
I'm pretty fortunate I work in health. I'm even more fortunate that I've spent a lot of time in low and middle income countries, primarily working with ministries of health. There is no problem communicating climate change in hardly any country, except here. Occasionally in Australia, but people in low and middle income countries see the impacts of climate change. They're feeling them right now. It doesn't take any convincing. It's really inspiring to go. I've had the privilege of working in villages with the poorest of the poor. They're seeing it. They're willing to do just anything that they can. You come in and they want to know, what else can I do? I'm seeing all these changes around me. I want to feed my family. I want my family to grow up and be healthy. And so that really isn't much of an issue. The US is the most polarized on climate change as an issue. And it's a political issue. It's not a scientific issue. And there is lots that needs to be done to really have people pay attention to science. And this is not unique, unfortunately, to climate change. And yes, Climate Central is excellent. Climate Central's got great graphics. They've got lots of very useful information. I would also look at the 6 Americas, because it's named the 6 Americas because they've divided the US population into 6 categories, from the very, very skeptical to those who are terrified, and are working on communication approaches depending on which segment you're talking about. As people understand more about climate change, they're moving from, there's a big group of, I'm not sure, into I'm definitely concerned, and making sure that they have information both about the risks and about the actions they can take is really important. And those are just 2 sources. There's lots of environmental NGOs that have got great information about communicating around climate change. And don't forget to look at our comedians. Most of our comedians put together these incredibly funny skits communicating around climate change. Jimmy Kimmel, for example, Colbert, others have great pieces that I use in my courses to talk about climate change because they're so effective.
Hey, great. Thank you so much. And I guess we're out of time. We used up all your time. That was wonderful. We really, really appreciate this. I mean, you're doing such amazing work, and your message is really timely, and it's really reaching a lot of people and having a huge impact. So thank you very much.
Thank you for having me. Good luck with the rest of your seminar.